I feel like I belong at CU DPT because, again, like their values are what I value. Like they have an emphasis on rural healthcare and service. And, I just want to be of service. I want to help people. I want to like be able to interact with people and, make their lives better. And I think that CU DPT places a really big emphasis on that in serving others and advocating for others. And, being a professional, somebody that people like can rely on and like they know they're going to get quality care. I'm from Appalachia, which is one of the most rural, underserved regions in the U.S. And, I love that community and I really want to give back to them. And so my goal is to, once I graduate, go back over there and again, begin serving in a clinic there and just trying to provide the best care possible. Obviously, Helene just happened pretty recently and kind of like did a lot more damage than I think a lot of people think. And it's, looking more and more like normal. It kind of really exposed a lot of things as far as like the discrepancies of healthcare there, because you have a lot of people that are, wealthy, and then you have the locals and like the surrounding communities like Avery and Jefferson that are like very rural. So you have the central, hub, the town of Boone, and the other cities like, Banner Elk and things. But then you have everybody that's not within the city limits is, a lot of people don't have Wi-Fi. They don't have access to public transit. They're dirt roads that I drive on all the time. And so getting to a clinic, affording insurance, things like that are definite challenges that I think, were just made clearly evident with Helene. I think you have to be curious. I think I'm realizing that more and more. Like you have to like have that hunger and thirst for like just knowing more constantly. Like it's not just like, you get done with school and like I know everything and like, okay, now I'm ready to do the job. It's like a constant learning process because like, orthopedic like surgeries are advancing all the time and they're thinking of new things and new like medications are coming out that like your patients might be taking. New studies are being done on like what exercises are best and which ones are more effective. And so you really have to be willing to learn continually, like throughout your career. You have to have that desire to, just serve others and help them. I think you have to be humble in that, like you won't know everything. And again, like that goes back to the continuing education. Like you have to be willing to learn and like adjust and pivot and just to better serve your patients. I like to pursue generosity the most, again, especially with my time and my resources. Being generous with your time, like that's a true like act of service. I try to do as much pro bono as I can, just because it's good experience. And again, another way to serve and like give of your time and your resources. And so once I graduate and figure out where I'm going to be, I'd love to, do more with the community, whether that's just as my job as a physical therapist or helping, with whatever projects, that I can get my fingers in, and really just plugging into the community, kind of giving back.